So do you guys want notes? Do you guys want notes for this osteology class? How does it help you? You go to home or hostel and you study it, right? So you have studied the scapula? You have studied, right? Okay, tell me. Where is the supraspinatus muscle attached here? Okay, tell me where is the supraspinatus muscle attached? Infraspinatus? Tell me which, is it left or right? Okay, then infraspinatus? Teres minor? Teres major? Subscapularis? Ulta. Okay, sit down. Teres minor and major. Where is the supraspinatus muscle attached? You have attended the class. You have written notes also. Okay, tell me frankly, do you guys even read it at home or hostel? Who has read it? Haath upar uthao. Raise your hand. Who has read it? The notes. You, and anyone else? You. But all of you want notes. So what's the point of me telling and you writing down the notes? Which book are you following? BD 84 and? Okay, so you can tell it. Sit down. Pass it to the guy next behind you. What's your name? From Tripura. West Bengal. Okay, tell me where is supraspinatus attached? You don't even remember. You have attended the class. You have written the notes. Okay. Very good. Okay. In other departments, there are exams going on, right? Physio and biochemistry. Okay. From next week, there will be exam for anatomy also. Okay. At least for that you read. Anyone else? Tumko aata hai? You can pass it to him.
So this is the right scapula. Supraspinatus muscle is attached here. Infraspinatus in this region. And
This region. You need to mention what is this region. Supraspinous groove. Infraspinous. Groove only. And teres minor and major? Teres major is angle of the scapula inferiorly. Okay. This is the angle. Okay. This, give me. This is the angle. Okay. So the reason I'm asking you about these four muscles specifically, because for humerus, these four muscles, wait. So these four muscles is related to both this. This is humerus. Okay. As you can see, this is humerus This is scapula. So during scapula, you are told that supraspinatus muscle attaches here, infraspinatus attaches here, teres minor attaches here. Okay. So if you attend all the class, you will be able to link the dots. Okay. Key, these muscles are attaching here, but where are they going? They are going like this, all the three, and attaching here in the humerus. So if you don't study, you won't be able to understand. Okay. If this is the scapula, right sided, this is the humerus, right sided, they join to form the shoulder joint. Okay. Supraspinatus, infraspinatus, and teres minor, all the fibers come here and attach here. So if you don't study, again you won't understand. Okay, for today. But yeah, frankly tell me, do you want notes? I can provide you notes, but पढ़ना पड़ेगा. So will you guys study? Okay. लिखो for humerus. In the exam from osteology, there will be two things. One thing will be spotters. Okay. There will be 5 or 10 tables. Okay. They might give you this bone. Okay. This is the posterior. I will tell you, this is posterior, this is anterior. Okay. They might keep it like this. So they might mark it here. There may be a mark. So you need to tell them or write in the paper what is attaching here. Okay. These things are called spotters. 1 minute or 2 minutes will be given to you. You need to go from this table to this table. Okay. Row by row. Okay. And next thing from osteology, there will be viva. If the examiner is generous enough, they will be asking you to pick anyone, and if little bit close, he will give you bone of his choice. Okay. So if they ask you to pick anyone, if you pick it up, then they will be asking you what is the name. So you will be telling them this is humerus. So next they will be asking, is it right or left? For side determination, all of you write. I will show you the points later. Okay. For side determination, you need to tell them, sir, this is the head of the humerus, this part. Okay, let me show you what you need. This is the, okay, tell me what are the bones forming the shoulder joint. Scapula and humerus. Okay, if you be more precise, then which part of scapula, which part of humerus? Yes. So in real life, this is the real bone. These are the POP samples. You will be able to understand and see everything. Okay. There is no groove tuberosity for deltoid. Okay. Can you appreciate this protruded part? This part. Can you see? This is deltoid tuberosity for the attachment of deltoid muscle. Do you know where is the deltoid muscle? This one. Okay. In the last dissection class, what are all the muscles you saw? Biceps brachii, then brachialis and thoracobrachialis. Okay. Okay. I will ask you to note it down. First, let me show you. Okay, this is the head of the humerus. Okay, this part. At the end of the class, I will hand over to you. This is the head. It is directed medially. You guys know medial and lateral. Okay. If it is right-sided, it will be directing. If it is here, it is medially or laterally. This head. Yes. This is directing medially, upward and backward. Okay. Write it down. For side determination, the first point will be the head will be directed medially, backward and upward. You all are writing the notes, but you go and study, huh? Next week there will be exam, and those marks, a little bit percentage from those exam will be added in your internal assessment. Okay, the HOD has told already. Okay, then can you tell me, is it the anterior or the posterior part? Is it anterior or posterior? Any idea? Just yeah, this is the anterior. Okay, so then next point for side determination, you will say there is this fossa. This is the posterior part. Okay, here is the fossa. This is called the olecranon fossa. Should I spell it out? Olecranon. Then write the olecranon fossa will be directing posteriorly. And for the third point for side determination, you will say this part is called trochlea. Okay, and this convex part, it's a ball-like knob. It's like a knob. Acha, Hindi or English? English. You guys have taken any subscription from the first year? Be frank. किसी ने तो लिया होगा. Everybody is quite advanced. नहीं लिया? तूने लिया? क्या लिया? Physics वाला. और कोई? क्या? Prep ladder. And anyone else? No one. Okay. ठीक है. So these things, this capitulum. This is called the capitulum. This is the trochlea. These things will be downwards in the lower end. Capitulum. See this part now. This is capitulum. This is trochlea, not pointed out. These things will be at the lower end. You need to tell them this. Okay? लिखो. लिख लिया? ओके. ओके, कुछ समझ में आया अभी तक? समझ में आया कुछ? ओके. Tell me, right or left? Stand up. Mention your name. Vrishti Vishwas. Okay.
It is the head.
Chill.
Olecranon.
You can see the points.
Acha. Olecranon fossa will be located posteriorly.
Yeah. There are two fossas in the anterior part, okay, and there is only one in the posterior part. This is one, okay, only one. In the anterior part there are two, this thing and this thing, okay. So, bolo.
Capitulum.
Yeah.
Capitulum and trochlea. dislocated downwards, and head is located backwards and medially backwards.
And upward. Then
And this is polytrenal.
so the conclusion.
So it is left.
Yeah. Hold it with your left hand. So in the exam, after side determination, don't say it is left-sided like this, huh? Say it is left-sided. Okay. Hold it with your specific sided hand. Okay. समझ में आया? कुछ समझ में आया? ठीक है. Okay. Then this is for the side determination. Then they might ask what are the different parts. 3 parts. Upper end. This is the shaft, means body. This is the lower end. Okay. लिखो. Upper end, shaft, and lower end. So, for the upper end, there are few things. This is the head already described. Then there are the 2 tuberosity. Tuberosity is bony prominence. Bony prominence means there is a bulge in the bone, like a tubercle, it is protruding out. Okay, there are 2, 1 and 2. Okay, one is greater tuberosity, one is lesser tuberosity, right? In the upper end, there is one thing called head of the humerus. Number 2, there is 2 tuberosities. One is greater, one is lesser. So the greater tuberosity will be directing laterally. If this is the right part, right humerus, this greater tuberosity will be directing laterally. And the lesser tuberosity will be facing forward. Okay? Facing anteriorly. Okay? Write it down. Are you writing it down? The greater tuberosity will be facing laterally. And the lesser tuberosity will be facing anteriorly. Okay? Likha. So, if there is 2 tuberosity, this is bony prominence and this is bony prominence, okay? निकल के आ रहा है. So, in between them there is a groove, depressed structure, depressed part, this part. There is this bony gap. If this is 2 prominence, there will be a gap, okay? You see it for yourself. Pass it to everyone. देख लो. Pass it to. पीछे दे दो. So next point you write, there is a groove in between those 2 tuberosities, greater and lesser. You write the name, that is intertubercular sulcus. Intertubercular, between both tubercles. These are tubercles also, These are called greater tubercle, this is lesser tubercle. So intertubercular, between both the tubercles, okay? Intertubercular groove or intertubercular sulcus, okay? लिख लिया? You guys have bought bones. किसी ने bone खरीदा? किसने किसने खरीदा? Raise your hand. How many of you are staying in hostel? You only. You are from Dharmanagar, but staying in hostel. Okay. And who is staying at home? Day scholars. Okay. So how are you guys going to study bones? कैसे पढ़ोगे? कैसे पढ़ेगा? How will you study bones without bone? Okay, you will buy. तू बोल. You will also buy. You have bones. Who doesn't have bone? So raise your hand. You will also buy. So everyone is going to buy or what? कौन नहीं खरीदेगा? दोस्तों से लेकर पढ़ लेगा. Any freeloader? No. Okay. Okay, buy as soon as you can, at least, because there will be exam. And if the HOD takes exam, then there is something called impression. Your first will be your last, so prepare accordingly, okay? खरीदो और पढ़ो. Okay, pass me the bone. That ये गंदा वाला है, ये वाला दे दो. देखा? देख लिया? ओके. ओके, ऊपर वाला पार्ट समझ में आया? ओके. दिस इज द शाफ्ट. लिखो हेडिंग shaft. It is cylindrical in the upper part, like a cylinder, like a tube. And in the lower part, it is triangular. So if there is a triangle like this, okay, this is a triangle, facing it like this. So what will be this border? If it is a triangle, okay, suppose it's a triangle, it's a bad one, but if it is facing like this, what will be this border? What it is facing? Anterior or posterior? Okay. And this, if it is right sided, then no. Lateral and medial, okay? This will be medial, this will be lateral. So in the lower part, there are three borders: anterior, medial and lateral. The guy with the mask, hello, bolo, which side it is, right or left?
Left side.
Why? Stand up, explain.
So there is a left humerus bone. Left of the humerus is backward and upward. The downward portion and the auricular portion is always.
You can see in your notes also. Tell me the 3 points. These things are basic, at least. Before asking your name, they will be asking you this. So, by heart this. Okay. Bolo.
So the head of the humerus is directed medially backward and upward, and the outcome for the directed posteriorly, and the capitulum and the trochlea of the humerus.
Will be?
With the lower end.
Very good. De do. So, if it is a triangle in the lower part of the shaft, if this is a triangle, okay, this part, okay, this part, what will be this surface? This surface will be, what do you think? Like this. I am keeping it like this. What will be this surface? Yes. And this surface, this, yes, anteromedial and anterolateral. Write it down. There are three surface. Anteromedial. Anteromedial is between which borders? Anterior and very good. And anterolateral, and one is posterior surface. The posterior surface is between ठीक है लिखा. Then the lower end. Okay. In the lower end, in the medial side, there is this part, medial epicondyle, as you can see here. Okay. Likho. In the medial end, there will be medial epicondyle. In the lateral end, there will be lateral epicondyle. Okay. Then there is one fossa, olecranon fossa, facing posteriorly. And there are two fossas facing anteriorly. Likha. Two fossa will be facing anteriorly. If I ask you between this and this, which is my radial side? Not medial and lateral. Which is my radial side? Yes, this is the radial side. So there are two fossa. One is radial fossa facing laterally. One is coronoid fossa facing medially. Write it down. Writing notes is not an obligation, okay? If you want, you will write. If you don't want, you just see. Likha. Done? Okay. Brachial plexus has been taught to you or not? HOD sir ने पढ़ाया? Okay. So at least now you know the nerves. कहाँ से आ रहे हैं? Where they are originating, where they are going. At least the names. Brachial plexus will be a short question. Okay, in the theory class. So from the brachial plexus, this axillary nerve is coming. Okay, going back of the humerus, supplying this. यहाँ पे कौन सा मसल रहता है? What do you think? Yes, deltoid muscle. Okay, so has anyone got any intramuscular injection here? Injection यहाँ पे लगा है कभी? So if you go too far, you might prick this nerve. Okay. This is called regimental badge area. Okay. In the regiment, in the army, they put medals here. Okay. This is called regimental badge area for traumatizing the axillary nerve. And there is, write it down, surgical neck of humerus. It will be a short note for 2 or 5 marks. Surgical neck of humerus. Okay. So you know this is the head, this is the body. So connecting those two are the neck. Okay. So here every bone has got its blood supply. Okay. This is the axillary artery. Okay. It gives two branch. One is posterior. Always the dotted marks, you assume it's posterior, and if it is like this, it will be anterior. Okay. There are two arteries from the axillary artery only, okay? One is anterior, one is posterior. They encircle the surgical neck of humerus like this, okay? It is for surgical importance. That's why it's called surgical neck of humerus. Because in a road traffic accident, if this part is broken and the orthopedic surgeon is going to operate on this area, if they become reluctant, and they might cut or injure these vessels, so there will be lots of blood loss, okay? So if they ask you in the exam, write down about surgical neck of humerus, you will write this part. That from, do you want to write? Do you want to notes or everything? Okay. Likho surgical neck of humerus. Likho, in the surgical neck of humerus, there are two branches. And in anatomy, always draw diagrams. Make it a practice to draw diagrams. It is very important. It will give you good marks. Okay. So, if they ask you, you need to draw this. Okay? So, there is two arteries. Naming those, this is anterior humeral. Anterior means anteriorly जाके posterior से मिलते हैं, ठीक है? So one is anterior humeral circumflex artery. Write it down. Those who want to write it down. And one is posterior humeral circumflex artery. They meet each other, okay? So it is called anastomosis. Okay? There is anastomosis of these two arteries. So, right, जिसको लिखना है लिखो, जिसको लिखना नहीं है, don't bother. So, while operating this in this area, in any case, बोलो. Anastomosis, like capillary. Capillary is anastomosis between artery and vein. ठीक है, लिखो. There is anastomosis between those two. Okay. So during operation, this artery might get injured. So there will be blood loss, which may be devastating for the patient. So this is the clinical importance or surgical importance for the surgical neck of humerus. Okay. ठीक है. Next. All of you, I will not tell you one by one key. Suppose there is a deltoid muscle which is inserted in the deltoid tuberosity. Okay, this will be boring and monotonous. You need to study in anatomy from head to toe. कितने याद रखोगे? So, draw a diagram of this. Draw at least the humerus part. You draw. I will be telling you to mark it anything, but you first draw the humerus. Drawing आता है किसी को? जितना भी आता है ड्रॉ करो. सी मैंने भी ड्रॉ किया. ड्रॉ इट. Draw humerus like this. Okay. First you draw the outline of humerus. And make it a little big so we can accommodate those muscles and their names. Okay. This will be anterior, and in the next page you draw the posterior. This is the posterior part. Okay. For anatomy, just draw. And bring one red pen and one blue pen in anatomy osteology class at least. Okay? Do you know why it is one red, one is blue? But pata hai? This is for the origin and one is for the insertion. Okay? The muscle are originating from the red one, red marked area, and in the blue these are inserting. Okay? So I'll tell you, I'll show you, I'll give you an idea. Just पहले draw this humerus. Drawing हो जाए तो बोलो. I just asked you for the outline. Okay, ठीक है, मैं बोल दूँगा. You just draw the humerus, not these parts. Okay, just the humerus, the outline like this. Okay. What is this part? This tubercle? It is right sided. Okay. What is this part? What is this? Okay. So in the exam, there may be a blue mark here. They'll be asking you what is inserting here or attaching here. Okay. So if I tell you now कि the subscapulary muscle is attaching here, you'll be memorizing it, right? But whenever there is a muscle, any nerve, you go and you get an image in the Google Chrome or wherever you want, you will get an idea. Okay, this is the subscapularis muscle. Okay, in the scapula class, you have been taught where is the subscapularis muscle originating. कहाँ पे होता है origin? मतलब attach कहाँ पे होता है बोलो? यहाँ पे. Tell me. Subscapularis. You can show? Yes. So it is attaching here. It is attaching here also. So basically the subscapularis muscle is originating from here. Okay. And it is inserting here. How? Let me show you. Like this. Okay. यहाँ पे origin होता है, इसका फाइबर आके यहाँ पे इंसर्ट होता है. ठीक है. सो डोंट मेमोराइज, पिक्चर देखो, थोड़ा बहुत आइडिया लो. अभी सब कुछ नहीं समझ में आएगा. यू विल बी इन सिंक विद टाइम. ठीक है. कुछ समझ में आया सबस्कैपुलरिस? ओके. सो या, सो राइट अबाउट दिस इज फॉर द सबस्कैपुलरिस. ओके. सो right, in the lesser tubercle, subscapularis muscle is attached in the lesser tubercle. You have seen the lesser tubercle. Okay. If you want to note it down, you can note. Otherwise, in those picture, you would mark it out. Okay. जो पिक्चर ड्रॉ किया है उस पर भी मार्क कर सकते हो, या फिर यू कैन नोट इट इन सिंगल लाइन कि सबस्कैपुलरिस मसल इज अटैचिंग इन द लेसर ट्यूबरकल. ओके, लिखा? सो दैट्स व्हाई आई वाज आस्किंग अबाउट दिस मसल कि स्कैपुला पर आ कि नहीं. सो देयर इज 3 मसल. SIT, supraspinatus, infraspinatus, teres minor. You guys have studied, at least you have been taught in the scapular class, supraspinatus, infraspinatus, teres minor, originating from here. Okay, so how they are inserting here? Always with picture like this. Okay, in the greater tubercle. This is like this. Okay, greater tubercle. This is greater tubercle. So you write, this is SIT structure. This is a mnemonic. You guys need to learn lots of mnemonics or make it your own. SIT, supraspinatus, infraspinatus, teres minor. They attach in the posterior superior, one posteriorly and superiorly. Okay, this is the posterior part. Okay, this is the anterior. So posterior and superior like this. Okay, this is the superior, this is posterior. In the posterior superior surface of greater tubercle. लिखो या फिर मार्क करो इमेज पे. कुछ समझ में आ रहा है? Are you guys getting anything? Posteriorly and superiorly. So it is posterior superior surface of greater tubercle. Okay, greater tubercle is most lateral. So from behind also, if it is most lateral, you can see it like this. Okay, it is most lateral in the upper part. Okay, so its posterior superior surface will be, this is posterior and this is the superior, like in here, like this. Okay, इतना नीचे नहीं आएगा, इतना तक आएगा. ठीक है? This is for the SIT structure. Okay, समझे? Then there is another mnemonic, lady between two major. लिखो, note it, lady between two major. Lady between two major. Okay, lady, LADY, lady. Okay, let me tell you. This is, क्या है ये? This is, ठीक है. I have told you there is a groove structure. Okay. So if there is a groove, there will be margins also. Okay. If something has a groove, जैसे show करो. If something has a groove, if it is the groove, these are the margins. Okay, so one muscle will attach here, one muscle will attach here, one muscle will attach here. These are the major. This is the lady. This is the lady between two major. Write it, the mnemonic, lady between two major. Okay, lady between two major. The lateral major. This is the pectoralis major. This is the teres major. This is the lady, latissimus dorsi. ठीक है? Lady between two major. I'll show you. First, in the lateral, you write it down. In the lateral lip of the intertubercular groove or sulcus, there is pectoralis major muscle. In the lateral lip, let me show you the pectoralis major. See, this is the pectoralis major. इधर से ओरिजिन होके इसका फाइबर ये लेटरल लिप पे आके मिलता है. ठीक है? This is the lateral most major. If you like the mnemonic, I like it because that's why I said it. But this is the in the lateral lip of the intertubercular sulcus. लिखा? This is the pectoralis major. Okay? In between them there is latissimus dorsi. This is the latissimus dorsi. When we dissect the back of the cadaver, you will be shown. This is the latissimus dorsi originating from the back. These are the thoracic vertebra. Okay, it is coming and attaching in the sulcus or the groove, right? Latissimus dorsi attaches in the groove, the floor of intertubercular sulcus. This one, lady,
Attaches in the group of
intertubercular sulcus. There is two tubercle na, so between them there is a sulcus or a floor, right? This is that part only. And then there is another measure. This is the teres measure. So in the scapula, it originates from the angle of the scapula, comes like this and attaches in the medial lip of the intertubercular sulcus. Write it down or mark in the image. Teres measure attaches in the medial lip of intertubercular sulcus. तो ये तीनों किसको किसको नहीं समझ में आया बोलो? मेजर एंड दिस पार्ट, दिस थ्री मसल किसको नहीं समझ में आया बोलो? रेज योर हैंड. सबको समझ में आया? किसको नहीं आया समझ? रेज योर हैंड. Once again, this is a concert. Okay. जब बात खत्म हो जाए बोल दो. ओके. दिस इज ग्रेटर ट्यूबरकल, दिस इज लेसर ट्यूबरकल. ट्यूबरकल मीन्स ऐसा प्रोट्रूडेड पार्ट, प्रोट्रूशन, ठीक है, जो कोई ये प्लेन है, ये एक प्रोट्रूशन हो गया इसका. हाँ, दिस इज ट्यूबरकल. ओके, ये ऐसा एक इधर रहेगा, ऐसा एक इधर रहेगा, तो दोनों के बीच में एक गैप होगा. देयर इज अ गैप. सो अगर इसको देखो, दिस इज द गैप, ठीक है. तो अगर इस ये गैप होगा, देयर इज अ लिप हेयर. लिप बोलो, बॉर्डर बोलो, जो भी बोलो, इन एनाटॉमी यू कॉल इट लिप ओनली, ठीक है. दिस इज द मीडियल लिप, दिस इज द लेटरल लिप, ठीक है. यहाँ पे एक मसल अटैच होता है, यहाँ पे एक होता है, यहाँ पे एक होता है. ओके, दीज आर द मेजर मसल. This is the lady muscle. Lady muscle means for the pneumonics. No offense to any lady. Okay. This is the latissimus dorsi. ये lateral है, ये medial है. Okay. So in the medial there is pectoralis major. In the lateral, sorry, this is teres major. In the lateral part, this is pectoralis major. In between them, in the groove, or in the floor, or in the sulcus, these are all the synonyms. Okay. This is the latissimus dorsi. अभी समझ में आया कि नहीं बोलो? मैं समझा दूंगा, पर घर में जाके नहीं पढ़ने से want to get anything. You need to study, and without exam you guys don't study also. ठीक है? Then in the middle there is no tuberosity here. You cannot appreciate it. ठीक है? But there is a tuberosity here also in this part, in the middle. So you all write or mark in the image. There is deltoid tuberosity, where that deltoid muscle is attached. Deltoid muscle is attached in the anterolateral border. जो बोला था, हाँ? This is lateral, right? This is lateral. This is medial. In the lower part, it becomes a triangle. जो पहले बोला था. So this is anterior border, this is lateral border, this is medial border. So anterolateral border में there is a tuberosity deltoid. So here the deltoid muscle is attaching. Okay. Then in the previous dissection class, you guys have seen the brachialis muscle. Have you guys seen? किसने देखा उस दिन? क्या क्या देखा था उस दिन डिसेक्शन में? Someone stand up and tell me. You. Hello, ma'am. Stand up. What have you seen in the last dissection class?
Biceps and after that brachialis.
And why did you see the brachialis muscle? Why did you see the brachialis muscle? In the upper part or the lower part? Brachialis muscle you have seen. You have seen in the forearm or which part? What is arm? What is forearm? So you have seen in the arm. Okay. Upper part of the arm or in the lower part of the arm? Upper part. Okay, very good. You go and see today if it is in the upper or lower part. Okay, sit down. This is the brachialis muscle she is talking about, and it is in the lower part. You all go and see today. There will be dissection class, so you can see the brachialis muscle. Okay? So you either point it out in the image or you write it down. The brachial muscle is attached. Better. The brachialis muscle is attached in the lower half of the humerus anteriorly. Then there is one muscle, brachioradialis, this muscle. You point it out. Brachioradial. What is brachium? Yes, brachium is arm only. So in anatomy, there are some terms which are self-explanatory. If you connect this, you will get to the answer. Brachioradialis. There is this radius bone, there is this ulna bone. You will be taught. So from brachioradialis, you can guess at least key. This is arising from the brachium, means arm. Arm bone is humerus. To the radialis. It is saying radialis, so it is going like this and inserting in the radius. Okay, right. Brachioradialis muscle is attached on the anterolateral surface of lower end of humerus. Am I making any sense? पिक्चर देख के कुछ समझ में आ रहा है? Then these are the group of muscle. Common extensor origin and common flexor origin. You mark it in the image. You write common extensor origin muscle. You write common extensor muscles are originating. You tell me. Okay, मैं बहुत बोल लिया. You tell me. Common extensor origin are originating from. ये क्या है? What is this? Lateral epicondyle. Yes. So image देखो, खुद बोलो. Extensor muscle are originating from the anterior surface of the lateral epicondyle. ठीक है? लिखो या फिर मार्क करो. Then you tell me this common flexor muscles. There will be group of muscle arising from here. Okay. Then you write it. Common flexor muscle. What is this? This part. Yeah. So common flexor muscle are originating from the anterior surface of medial epicondyle. This muscle you will see today, pronator teres. You tell me, what is this? This is very good. So if this is medial epicondyle, okay, and this muscle is originating from here, it is little up, right? So this is supra. One is infra, one is supra. Supracondylar ridge. So you write pronator teres originates from the supracondylar ridge on the medial side. There is this muscle. This muscle was somehow shown to you in the last dissection class, coracobrachialis. What can you make out from this name, coracobrachialis? Yes, from the coracoid process to the brachium, coracobrachialis. So you write coracobrachialis muscle originates in the medial border of humerus, in the mid shaft. This is middle of the shaft. This is mid shaft area of humerus. Are you getting anything? समझ में आ रहा है? ठीक है. Origin देखना है? देखो. ये देख लिया, 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 ये देख लिया. इसमें तो नहीं था. It originates from the coracoid process. Coracoid process. किसने पूछा? तुमने पूछा. Show me the coracoid process. ये लो. Stand up and show me. Better. What's your name? Vishal Das from Tripura. Okay. Better. So these are the muscles on the anterior aspect. Okay. Then triceps. Any one of you go to the gym? कोई gym जाता है? So there is one muscle called triceps muscle. Okay. Tri means 3. Bi means 2. Biceps has 2 origin. ठीक है? From 2 places it originates. Tri means 3. It originates from 3 places. In the humerus, there are 2 heads. And one head is in the. You have been taught this scapula class. Why does the medial head of the triceps attach in the scapula? You have the scapula with you, right? What up? Where does the medial head of the triceps attach in the scapula? This. It has 3 origination. Okay. From 1 is here, 2 is from the humerus bone. Okay. What is this called? From the scapula. What is this part? Infraglenoid. You guys don't study. Okay, sit down. Better. So you can see baki 2 head. Okay. This is called, one is lateral head, one is medial head. This is the spiral groove. You write in the posterior aspect of the humerus, there is spiral groove. for the radial nerve. यहाँ से radial nerve पास होता है. Lateral medial long head. So you write the lateral head of triceps originates from the posterior aspect of humerus above the spiral groove. ये पकड़ो, stand up. So in the exam they will be asking you spiral groove you cannot make out here. Okay, so it is right or left? फिर से देखो. So in there is no spiral groove here. Okay, there is a groove, like it's a groove means depressed part. Okay, इधर से radial nerve will be passing. You cannot see it here. Okay, then how are you going to tell them that the medial head of the triceps is originating? Because I have said the medial head of triceps originates above the spiral groove, right? So how are you going to show them? Imagination. The examiner cannot argue with you, as these are PUP structures. They won't be able to make out the spiral groove. Okay, so you will have to imagine, and the examiner has to agree with your imagination. Okay, so show me the medial head of the triceps. Where is it attaching? You can see here and. Yeah. ठीक है, बैठो. So in the exam, if they ask you, you will show them the posterior surface. You will see, sir, as the spiral groove is not seen here, so we cannot surely say how it is originating. But the triceps, okay, it is for my, like, you can show them here. So if you are not sure about anything, you cannot pinpoint it like this. You show them like this. Okay, they'll be a little bit confused, and you will get the marks. Okay, so there is the medial head. Okay, yeah, I am also kind of confused. Okay, so there. Okay, समझे? ठीक है. And the medial head of the triceps originating on the lower. लिखो जिसको लिखने है लिखो. The medial head of the triceps originate from the posterior lower end of humerus. In the exam they won't be asking you word by word कि ऐसा है, sulcus बोलना है, groove बोलना है. At least if you have the idea, okay. See, if they ask you for the brachialis muscle in the dissection, at least you should know it is in the lower half. Okay. On the first go, you may not be able to see it, the brachialis muscle. But if you keep on looking here, sir, brachialis muscle, it will be a blunder. Okay. So like this is ulnar side, this is radial side. Okay, there is ulnar nerve also, there is radial nerve also. In the exam, if they ask you what is this, or they might tell you where is the ulnar nerve, show me. If you keep on searching here, it will be a big blunder. Okay, at least you should start your search from here. Okay, so these are the basic things, don't mess it up. Okay. As you can see, this is the content. Okay, for the biceps brachia there are two origins. Okay, long head and short head. The long head goes in, this is the content. Okay, this is not origin or insertion. What lies in the groove, as I have told? Intertubercular sulcus in the floor. What lies? Yes, the lady. So, उसके ऊपर से the long head of biceps goes like this. Okay. You will see it when in the cadaver. Okay. And there are 3 nerves related to humerus. Okay. This is the medial epicondyle. Okay. This part. So behind the medial epicondyle, you draw it. जल्दी से 1 minute में draw करो. And you point it out. सब कुछ का डायग्राम देखो, नेट पे सर्च करो. You guys will see it. ड्रॉ करो या फिर पिक्चर उठाओ, पर एग्जाम के पेपर में ड्रॉ ही करना. So there are 3 nerves related to the humerus bone. One is radial on the radial side, one is ulnar on the ulnar side, one is median nerve. The ulnar nerve lies posterior to it, posterior to the medial epicondyle. If you want to write, you can write. So if there is a skinny person, if you do this to him, there might be a tingling sensation. Okay. So this is for the ulnar nerve. Ulnar nerve lies behind the medial epicondyle of humerus. Everything is clinical orientation these days. So clinical case scenario might come. They might tell you there is a fracture of medial epicondyle, this part. So which nerve will get affected? Yes, ulnar nerve. So write down a term, ulnar claw hand. Ulnar claw, claw of lion, like you know claw, right? Ulnar claw hand. I'll show you. This ulnar nerve supplies, as you can predict it, at least understand, it goes like this and supplies this muscle. Okay, the radial nerve goes like this, supplies these fingers. Okay, these muscles and fingers. Okay, so this is clawing like a lion. This is called ulnar claw hand. If they ask you in short note, you can at least write or draw. Even they ask you about ulnar nerve injury, you draw this also. Okay, draw anything in anatomy. You just draw. You find a scope to draw anything in anatomy. Okay, this is ulnar nerve. See, this lateral 1.5 is supplied by the ulnar nerve. This blue part. This, sorry, medial. The lateral 3.5 is supplied by the radial nerve. Okay, ये बाद में पढ़ाएंगे सबको. Then there is radial nerve in the radial groove, spiral groove, which is lying posteriorly. Okay, if the middle of the shaft is fractured, which nerve will get injured? Radial nerve. So radial nerve. What is this section? What is this section? This is flexion of? Yes, this is flexion only of wrist. Okay, these are the flexor muscles. This is for the flexor muscles. You guys have seen na? These are the flexor muscle originating. You will be seeing this in today's class only. Okay, these are the flexor muscles. These are the extensor muscles, the back of the forearm. Okay, these are the extensor muscles. These are supplied by the radial nerve. Okay, so if the radial nerve, so what is, show me wrist extension. Wrist flexion is this, extension will be like ulta. Okay, so if the radial muscle, these are the extensor muscle. Okay, supplied by radial. If this nerve is injured, so muscle will be paralyzed. You cannot do this. Okay, so if you cannot do this muscle will be dominant. Flexor muscles. Hand will be like this. This is called wrist drop. So if there is radial nerve injury, there will be this thing. Write it down. For radial nerve injury, there will be something called wrist drop. Okay, then there might be a clinical case scenario, right? This is frozen shoulder, right? Frozen shoulder. Also known as adhesive. 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 फिर से बोलो. Adhesive. ADHESIVE. Adhesive capsulitis. Itis meaning inflammation. Always remember. So this is normal. This is the shoulder capsule. This is an inflamed joint capsule. So there will be lots of pain. There might be a short note from this. This is frozen shoulder. Okay. It is, you can see in the diabetic patient. So there might be a scenario for where you have to give them steroid injection in the joint also. Okay. This thing is gone. This is normal X-ray. देख के रखो. If someone comes to you, at least if you can say it is normal or not. Okay, there may be a case where one of your relatives had any accident. So if they come to you with this, at least this is the, what is this? This. What is this part? This is the normal. Okay. और फिर ये देखो. Okay, so scapula. I need the scapula. Scapula. There is a hip joint. There is a shoulder joint. Okay. So in the hip, this is the femur bone. This is the hip bone. Okay. The head of there is also a head of femur. The head of the femur attaches to the hip bone. Okay. There is a big cavity where it can accommodate the head of the femur. But in real, not, I'm just imagine. This is the head of the humerus. This is glenoid cavity of scapula. In real life, this is a very small cavity. In real life, this head is not completely accommodated in this. So there is a quite common scenario called dislocation of shoulder, as you guys have seen. Okay, और एक दो स्लाइड से रुको. अच्छा, without bones are you going to study? I am confused. You stand up. You. No. Yeah. If there is something funny, if there is any joke, you can tell me. I will also laugh. But it has to be laugh worthy. I will also laugh. You can tell me. What's your name? From here? And schooling? You passed out from? Don Bosco. Sit down. Okay.